This is the My Inner Therapist podcast, and I'm your host and empowerment coach, Nicole Seals. This show is dedicated to discovering our innate ability to transform our lives. Think of it as an opportunity to look at your life from a safe distance, from the seat of being your own therapist. In this role, you'll learn to become an observer of your life. It's an effective way to separate our thinking self from our doing self. This way, we can take inventory of our thoughts, beliefs, and stories without judgment, but with awe, humility, and love. It's so easy to get distracted and derailed from our goals, so let this be your refuge from the storm that is life. If you're done with self-help books and programs that disappoint, then I encourage you to take this journey with me. And like any good road trip, you'll need to bring a few things. Come with an open mind, a sense of humor, and the courage to see your truth. I'll be rummaging through my stuff right along with you because we're all a work in progress. The goal is to laugh and learn our way to becoming our own inner therapist, to rewrite our stories and beliefs so they align with the vision of who we want to be. Join in the discussion by sharing your comments and thoughts. And if you're interested in having a free, anonymous coaching session with me here on the show, you can contact me directly at nicole@myinnertherapist.com. Be sure to subscribe to the show on your favorite podcast app. To learn more, visit myinnertherapist.com for access to articles, videos, and my self-help programs. You can also follow me on Instagram at, you guessed it, My Inner Therapist, or subscribe to my YouTube channel. You'll find all of these links in the show's description section. All right, enough with the intro. Let the session begin. Hi all, thank you for joining me today for this topic, for this special episode, which is a follow-up from last week. I'm glad that you're here. It is always so much better to know that you're out there listening, and it's great to hear from you too. If you have any comments or questions, like I got a number of comments from last week's episode. I love that engagement because if I don't hear from you, then I'm never quite sure how people feel about the show and what your takeaway is. So continue to reach out to me and connect with me so that this feels more like a discussion. So rather than me just kind of sharing my opinions and my thoughts with you, I really want to hear feedback from you. And that's especially important for today's topic because we're going to be talking about something which I think is so crucial, so important. And that's how normal emotions get misdiagnosed. And really at the core of this discussion today is us talking about the truth about mental health diagnosis. And I think that there's a common misunderstanding that mental health diagnosis is the same as medical diagnosis of like a disease. And this is inaccurate. And in order for you to make informed decisions, you really need to understand what the difference is. And so last week, I shared with you my professional journey that really resulted in me making the decision not to become a licensed therapist, although it was something that I originally set out to do when I went to school, and I had done everything necessary to go get my license, getting my hours, getting the work experience. And there were another number of reasons that came up for me that made me realize that this was not, that particular path was not in alignment with the type of work that I wanted to do. And I got a couple comments. It was really interesting because I think what people heard from that is that I had my suspicions about this whole mental illness thing and whether or not what people are dealing with is actually considered a disease because it's not, you can't actually use scientific assessment tools like you would for a disease that manifests in the body. We don't necessarily have those type of tools to use to diagnose mental illness. And so I think that a lot of people alluded that I was possibly questioning the realness of mental illness. So I want to make a definitive statement I want to go on the record saying that my decision not to continue the work of treating mental health disorders was a personal choice. It was not a good fit for me. And last week I noted some of the reasons, and in those reasons, I was not at all suggesting that mental illness is not real. And I can tell you from my years of having worked in the treatment of mental illness that it is very real. And I'm also not casting doubt on the effectiveness of psychotherapy, which is quite the contrary. I'm a huge advocate for psychotherapy. And in severe cases of mental illness, I actually support the use of drug treatment, which is saying a lot for me because I'm typically opposed to the use of drugs to help ourselves heal. So what last week's episode and today's show is really about, and I hope that this is a clear message, is it's about daylighting the mental health industry, right? So many consumers, so many people are in the dark about how diagnoses are really made, about the role that insurance companies play, and how a diagnosis influences your beliefs about mental health. So I want to shed some light on that. I want to daylight this whole idea of mental health treatment. And if you've been treated or you're considering treatment, you need to understand how this system works. Only then are you equipped to make a decision that's best for you. So let's go ahead and let's get to it because we've got some stuff to cover. I want to start by talking about the DSM. And last week I told you I'd be going into a little bit more detail about the DSM because it's a critical part of how people end up with a diagnosis. So the DSM, the Diagnostic and Statistical Manual of Mental Disorders, is a tool that is used by psychiatrists and psychotherapists, and it's used to identify and diagnose mental health disorders. Now this book or tool, assessment tool, has developed and evolved over the years, and it's currently in its 5th edition. The disorders are identified, they're named, they're categorized, and they're assigned a set of criteria, which are basically symptoms. And this work is done by a psychiatrist. And when I say this work, I'm talking about the development of the DSM, how it all came to be and how it gets put together and who decides how it gets implemented. And this was done by the work of psychiatrists who were brought together by a committee or I think they call it a task force, and they basically voted on what is or is not considered to be a mental disorder. Now, for more clarification, I want to read you this quote by Thomas Insel. And at the time of this quote, he was the director of the National Institute for Mental Health. So the quote goes, while the DSM has been described as a, quote, Bible for the field, it is at best a dictionary. The weakness real disease versus mental disorders is its lack of validity. Unlike our definitions of heart disease or lymphoma or AIDS, the DSM diagnoses are based on a consensus about clusters of clinical symptoms, not any objective laboratory measure. So when you or someone you know receives a diagnosis, it's based on a clinician's assessment of how many of the diagnostic criteria you meet for that specific disorder. That's why the validity has, since the beginning of this field really coming into play as far as psychiatrists treating patients, since that time the validity has been called into question because the assessment is subjective. it's not based on any kind of objective test or laboratory findings, right? We don't have the science to link symptoms to disorders yet. For now, it's based on professional opinion. We're always working towards being able to make that connection. And it's not to say that all diagnoses are just good guesses or that they're all inaccurate. What this does say is that it highlights the inherent problem, which is that there is a high risk of being misdiagnosed due to human error, and that human error being on the part of the clinician. So if you are going to see a clinician who is unskilled, inexperienced, or just unsure, it increases your risk of being misdiagnosed. Now, this should concern you for a number of reasons. And the first is that you don't want to be treated for a disorder you don't have. It seems pretty obvious, right? Secondly, your clinician will use this diagnosis to guide your treatment. And if it's the wrong diagnosis, you may not discover the underlying issue that's actually causing your symptoms. And more importantly, if you are going through your health insurance, whether it's through your employer or you purchased it on your own, if you're going through your health insurance to pay for therapy, this diagnosis will become a permanent part of your medical record, even if it is inaccurate. And I really need you to pay attention to that last part. It'll become a permanent part of your medical record, even if it is inaccurate. And therapists and clinicians know this, which is why some of them will actually explain this to their patients and involve their patients in the diagnosis decision process. Now, knowing that may make you uncomfortable because you're wondering, like, why am I, I'm not the professional. Why are they leading it up to me? Why are they asking me about this? And in all honesty, I think that therapists do this as a workaround in an effort to protect their patients and their clients. Because insurance companies use this information to determine things like cost, length of treatment, and what type of treatment is covered. So your diagnosis has a lot of weight to it. And all those things really need to be taken into consideration when determining how the approach that you're going to take, how you and your clinician are going to work together in regards to your treatment. Now, please hear me when I say this. When you go through your insurance, your medical information can be shared with your employer. So if you have employer-based medical insurance, your medical information can be shared with your employer. If you go to get new insurance, the medical information contained or that your old insurance company, that medical information can be transferred, and most often is transferred to your new insurance company, and it can be used to determine your coverage, to include whether or not you get coverage. Now, again, I'm not trying to sway you from going to therapy or from using insurance. I just want you to be informed about how these systems work and quite honestly, how they work against you. So here's another really important piece to this, and you need to take this into account. And that's the placebo effect. We've talked about this before on the show. I did a whole podcast on it. So if you haven't listened to it yet, the second that this episode ends, I need you to subscribe to the show and then go and check out the placebo episode, because I go into a lot of detail about how the placebo effect works, right? Now, because what we know is that the placebos are often more effective form of treatment, what we understand about the placebo is that during many of the clinical trials where its effectiveness is compared to a new drug that's coming onto the market, that the placebo often outperforms these new drugs. And just a brief 101 on placebos is essentially we are given a treatment, a false treatment, right? So if you're, say you've got high blood pressure and you are given a placebo instead of an actual drug to treat the high blood pressure, and because you believe that you are receiving the actual medication, that belief in and of itself has the power to actually help your body be able to heal. And that's essentially how the placebo effect works, right? It really is, rather than healing properties coming from medication, the healing properties come from within based on our beliefs. And so what we really don't think about when it comes to how this powerful cognitive ability that the placebo effect is, how it works for us, but there are also instances where it can work against us. Because just like you can have a strong belief in a cure, that you're taking a medicine that is going to cure you or it's going to alleviate your symptoms, you can also have a strong belief in an illness. So if you believe that you have major depression, if you're told that based on this assessment tool and what you've shared with me, the information that you've shared with me, I believe that you have major depression. If you buy into that, you may overlook the possibility of other causes for your symptoms, or the possibility that your symptoms are normal. And that's the challenge with getting a diagnosis based on a tool that really is so subjective, is that we know that there's times that someone is misdiagnosed and truly buys into the idea that they now have this mental disorder, and it starts to physically manifest. Because now it's having the placebo effect is having the same effect on their thinking, on their thought, just as it would in the instance of a cure or some type of treatment. Okay, so to make more sense of that, if I got you a little lost, to make more sense of that, in this book that I suggest you read if you're interested in learning more about this, the book is called Saving Normal. And it's by Alan Francis, and he's one of the world's, he's like a really famous psychiatrist, and he actually was on the DSM task force, I believe in 2014 or 2015. And this was when they were doing the DSM-4. And so he was on that task force, and he's well versed in the DSM. And also just he's a long-time experienced psychiatrist. And basically in the book, he explains why stigmatizing a healthy person as being mentally ill can lead to unnecessary, harmful medications. It can really cause people to have a very honed-in focus where we become blind to other options and possibilities. It can cause us to receive the wrong kind of treatment. It can we don't get the appropriate resources that we need, and all of this results in us draining the funds that are allocated to programs for mental health treatment, because there are people within the system who could be better served in other ways rather than going through mental health treatment. And he also notes that what happens when a clinician takes a normal, healthy person who's experiencing, say, some bouts of depression and gives them a label, we end up shifting the responsibility of mental wellness away from what is our own natural resilience, right? The brain has a natural resilience to cope and to adapt. And instead, we take this, we don't use this power because we kind of succumb to the idea that we are dependent on this force outside ourselves to help heal us and fix us. And that force is often the psychiatrist, or it's the drug, right? We put our, we put our healing in the hands of someone else. And for me as a professional, I really struggled with these truths. It turned me off to the whole idea of following through with getting my license and continuing the practice of social work. But I also know some amazing clinicians who have found a way to do good work, and they're out there really helping people within this complicated business of treating disorders. And you know what? I say more power to them, because I think we all need to find the area where we specialize. And it should also really resonate with who we are. And it should also be in alignment with our own values. So the whole DSM madness and the insurance companies being up in people's business, just didn't work for me. But I'd say the real deal breaker for me is the industries, and when I say industry, I mean the mental health industry. It's the complete disregard that the industry has for the role that nutrition and exercise and environment has on our mental health. Most therapists aren't asking if their client eats an inflammatory diet, or they're explaining to their clients how diet and a sedentary lifestyle can affect your hormones like serotonin, that a lot of the deficiencies that we have in regards to the good feeling hormones like serotonin are as a result of our diet, and this is a result of having a lifestyle that is void of movement and exercise. We're not talking about how deep sleep is so vital to emotional wellness. Now, thankfully, we're starting to embrace more mindful treatment practices like meditation, but that wasn't always the case. And back when I was in school, no one was talking about meditation as a treatment option. There's this other great book written by Dr. Shannon. He's assistant clinical professor of psychiatry at the University of Colorado, and he has a practice of integrative medicine. He has a holistic approach to the treatment of mental disorders, and he specializes in working with children, but his findings also apply to adults. And in his book, he states that, and this is a quote, "Our current medical system, from insurance companies to doctors, has become diagnosis-oriented to the extreme. Once a diagnostic label is applied, it is often understood so rigidly that many potentially helpful treatment options are ignored or disallowed by insurers, much to the detriment of patients." So in saying all of that, I want to wrap this up by making a few points. And that is, number one, it is normal to have bouts of sadness, depression, anxiety, insecurity, and stress. We all do. It's the natural ebb and flow of life. And I know it can feel scary and overwhelming and concerning, but trusting in your ability to cope and manage can move you through it. And each time you give yourself the opportunity to practice that, your skills get stronger, you feel emotionally stronger. And that's good, because we're never going to be completely free of these feelings. We are going to we're going to have life experiences that will cause us to feel depressed or insecure or stress us out. And that's a fact of life. But we can learn how to use these emotions to guide us to a place of new understanding and new perspective. That's what coping and adapting is all about. The second point I want to make is that I really hope that you use this information to advocate for yourself. This information, I'm not sharing this so that you get turned off to therapy, that you avoid all drugs, that you ignore symptoms or feelings that you may be having that are just getting out of control. I'm sharing this with you because I want you to use this in order to advocate for yourself. And that means letting go of the belief that your fate and your healing is in the hands of the professionals, or it should be in the hands of your insurance company. If your pressure to use a medication, or you don't agree with your diagnosis, or you don't want your insurance company to know your medical condition, you have options. And the more informed you become and the more empowered you feel, the more open you are to seeking out your other options, because they are out there. And lastly, number 3 is to trust your inner voice. Question what doesn't make sense to you, because that is your inner voice. When something doesn't feel right, that is your inner voice saying this requires more information. If what you heard today from me doesn't sound right, you should question me and go and do your own research. Tap into that feeling of when something feels right, when it resonates with you. And maybe that means that it's supported by some kind of evidence that maybe most, if not all, professionals agree with. Like that gives you confidence in it, because there's not this ongoing feud where people are back and forth, but that the majority of professionals within that field are like, yeah, this is actually, we've found a lot of supporting evidence to find that this is true. Look for that type of consistency when you're learning some new information. Be open to getting information from people who are considered to be alternative practitioners, which really just means that these are people who have gone back to historical practice or different cultural practices that have been around for thousands of years that just don't look like these traditional methods of intervention that we used. Be open-minded, and again, just get a sense of whether or not it feels right for you. And most importantly, if it moves you forward towards your challenge, but with a sense of safety and resilience, that's how you know that you're on the right track. Trust is about moving in the direction you need to go, not having all the answers, still having some uncertainty, but moving towards the discomfort, towards the challenge, but there is a sense of peace and safety and resilience that keeps you going. Okay, until next time, friends. All right, that's going to do it for today's show. Remember, your goals aren't achieved in the future. They are realized in the choices you make moment to moment. Until next time, friends.